Yeah, so I was asked, what do you do with these foals? And the answer is maybe nothing, right? I mean, these foals are going to eat well no matter what. That's one of the questions I get asked is, you get a foal with a big overbite or an adult horse with a big overbite, they're going to eat fine. It's not going to affect their body weight whatsoever, I promise you. It very much is a cosmetic issue. And if I say anything any different, that would just be untrue to you. As far as affecting performance, I've worked on Olympic level show jumpers that have had overbites that you could fit your entire fist behind their front incisors before you make contact with their mandibular incisors. So I would say probably doesn't affect performance. Those of you who are in the thoroughbred world, those horses run on a loose rein with their head and neck extended. So some of the things that occur because of the overbite really don't affect their performance. So it brings us back to a more cosmetic issue. Heritability, not fully understood. I've been a part of a few different genetic studies and one now as well, where we've tried to look at what gene and what specific alleles are responsible for those expressions. And the answer is currently it's complicated. It's more complicated than we thought. It's not as simple as you have one overbite mare and her babies are going to be overbite, or you have one overbite sire and his babies are going to be overbite. This is not a dominant trait, although we do believe there is some heritability involved. So why is it a problem, or is it a problem? One of the things that happens is that top jaw grows forward. You get that goofy upper lip. Obviously, it doesn't look attractive, right? Those of you in the halter horse world will know that's a big no-no. But what else happens is those cheek teeth tend to shift forward as well, meaning the top row of teeth will shift forward, and that very front tooth won't have contact with a lower cheek tooth. And in the back of the mouth, the same thing happens. That very top row of teeth will be shifted forward, so the very last, most backwards molar will not be in contact. And so those will be allowed to overgrow. And those of you who are in the dressage world who ride under double bridles in constant collection and contact with your horse, and you're getting that cue back from your reins, those horses have a little trouble with rostrocaudal motion and movement. So now maybe we are getting into some horses that will see some changes in their management style. So so what do you do for these? If you catch it as a foal and you are concerned, there is something we can do about it. People have tried different things as far as feeding elevated to see if that will help. I'd say that's not something that we've found great results with. But one of the things we have done is some of these less invasive procedures that are tension band wiring. This is an orthodontic procedure, no different than what your children may have, or maybe you had as a young child yourself. And these orthodontic procedures are essentially braces put on to retard the growth, slow down the growth of this top jaw, while the lower jaw has a chance to catch up. Now, to do that, you've got to do this as a foal, while this skull and the craniofacial bones are developing and growing. And ideally, you do that early as a foal, not after you've weaned, per se. Now, there are more invasive procedures that can be done once the skull has stopped growing. So patient selection is a big part of this. 6 to 12 weeks, if you think about how foals are born, typically they have no teeth, or maybe they have two central incisors, one on each side, top and bottom. As they grow, the middle and corner incisors will erupt. We like to do these when the second tooth comes in, if you will. So rather than having two teeth, we'll have four teeth, top and bottom. We like to do it at that point in time, and what we'll do is we'll put braces on along with a bite plate. And that bite plate is so that those lower teeth have something to contact. Those of you who have seen this, it's a relatively uncommon condition, but we have a lot of managers in the farm that manage large numbers of foals. And we'll see 3 to 5% of the population of foals every year born with an overbite, with a parrot mouth, of varying degrees. Many of them are so mild you wouldn't consider correction, but those of you who have seen them, they can become quite advanced. And that top jaw can not only overjet forward, but it can overbite and have ventral curvature downward. And so we try to avoid that by using a bite plate. The goal is to maintain occlusion and to prevent these larger hooks from developing as they grow. And so what we do is we place some tension band wiring, and here's a foal we've done sometime, looks like 2020 here. Wires coming back all the way around. And from a lateral view, you've got an aluminum plate here, some acrylic on the front to protect the wires. And so this is one that's been on for a little while, and those teeth are nearly lined up. When we started, it certainly wouldn't have been quite like that. What this looks like in person is, this is a horse on a table here under anesthesia. We've got wires in place to try to retard that growth, and quite a big gap here between those top teeth and bottom teeth. When we're done, there's a piece of aluminum, some acrylic, looks like he's been at the nail salon, and a few months later, 6 months later, these teeth are matching. And so that's kind of the goal. That's what we'd like to see happen. But the real key to that is early intervention and trying to get on top of these while they're young and still at the mare's side. So with that, I will hand the mic over to our MC, Dr. Metcalf.